I'm Dr. Rebecca Bowers, and in this video I will be discussing what I refer to as herniated fascial points, but those familiar with the fascial distortion model are more familiar with the term herniated trigger points. I will discuss the points I was taught at an osteopathic FDM course, as well as inverted points I have since observed, and the novel way I treat both of them, which is usually painless and does not require as much force. For those who may not be familiar with a herniated trigger point, it is one of the 6 types of dysfunctions of the fascial distortion model. It is described as an abnormal protrusion of tissue through a fascial plane, and that often there is a palpable knot of soft tissue in the area the patient is complaining of pain. During the osteopathic FDM course I took in 2014, only points of fascia that herniated outwards were discussed, and the treatment was to push as hard as necessary to force the herniated point back to its more deep normal position. This was at times a painful process, and bruising did occur. Pain and bruising are sometimes a necessary part of medical treatment, but I have found a gentler method that treats both the traditionally described points that herniate outward as well as other points that herniate inwards. I refer to these points as herniated fascial points since that is what they are, and they do not have much, if anything, in common with Travell and Simmons trigger points. I find it useful to divide these herniated fascial points into 2 categories. Everted points, which is when deeper fascia is herniated outwards and being pinched by more superficial fascia, and inverted points, which is when superficial fascia is herniated inwards and being pinched by deeper tissue. To me, the everted points feel like a nodule of soft tissue that is only a few millimeters diameter at most, while the inverted points feel like a small funnel-shaped distortion of fascia tethered to a deeper point. Around both of these types of points, the fascia is twisted clockwise or counterclockwise. This twisting is not something common to Chapman points, counterstrain points, trigger points, or dysfunctional acupuncture points. Now I'll discuss how I treat these points, and then I'll show you in some videos how to treat them. For an everted point, first pull the superficial fascial layer or layers that are doing the pinching away from the herniated soft tissue nodule that is being pinched. In a second or 2, you should feel a relaxing of tension in those tissues. Then gather the superficial fascial layer towards the herniated point. After that, push the herniated point back through the superficial fascia, noting which way it naturally rotates back in, clockwise or counterclockwise. Follow this rotational preference in order to screw the herniation back into its rightful place. Whichever direction the herniated point rotates, rotate the pinching fascia the opposite direction. Treating an inverted point is much easier. First, gather the deeper fascia layer or layers towards the herniated point. In a second or 2, you should feel a relaxing of tension in those tissues. Then, just pull the superficial pinched fascial layer out and away from the point it's being pinched at with a slight twisting motion. The direction of the twisting does not need to be paid attention to. Just pull away from the point and vary the way you twist. It should come out after a few pulls. Sometimes both inverted and everted fascial points will both be present in close proximity to each other. I have found it is helpful to treat the inverted points prior to treating the everted points. Let's watch me treat an inverted point. Treating an inverted point. Find where it dips in. Notice that the fascia is twisted around it, which indicates that it's going to be a herniated point. It's inverted. I gather that deeper layer that's pinching the more superficial layer. So I gather that deeper layer and I bring it together. And in a moment or 2, you feel some kind of relaxation. So then, basically, it's like I'm pulling and twisting that superficial layer and trying to pull it out of the hole that it got herniated through and stuck in. There we go, and I felt that it released. Next, let's watch me treat an everted point. Found an everted point, so the point is herniated out towards me. The more deep tissues are herniated through a more superficial tissue that's pinching on it. I know because I feel the little nub sticking out at me, and also around there, the fascia is twisted. All right, so to treat these ones, I take the superficial fascia that's doing the pinching, and I want to separate it. So here's that point. I want to separate it and pull it away from that point, kind of opening up the buttonhole, and I felt stuff relax. So then I gather everything, bring it together, all those superficial tissues. And then now for this one, I end up, and I'm going to show you exaggerated, I twist my hands in opposite directions. How do I know which way to go? Well, I notice the little everted point, and it has a preference when I first push into it to be twisted clockwise. So I will twist my other hand counterclockwise as I push it through. As I'm pushing through, it changes its preference, and now it wants to be counterclockwise. So now I'll twist this one clockwise with my right hand, pushing that point through gently, and now the point's twisting again to go clockwise. So now with my right hand, I'll twist counterclockwise. It's twisting again the point. And I think we got rid of it. There we go. When I'm not having to explain what I'm doing, it takes much less time to push the point back in while rotating the fascial layers. I have made this video as a resource for other physicians and body workers. Do not attempt to perform any manual techniques unless you are a physician or body worker or a student under proper supervision.